Hi there guys, how KICS families, how you doing? I'm here with Dr. Gregory Primus. He is a board-certified orthopedic surgeon and founder of the Chicago Center of Sports Medicine and Orthopedic Surgery. We're here today with this great facility. He played 3 seasons in the NFL, 1 with the Denver Broncos and 2 with the Chicago Bears. Super impressive. Dr. Primus focuses on, and please tell me if I get this wrong, arthroscopic surgery and reconstruction of all the major joints.
That's arthroscopic.
Arthroscopic, there we go, sorry. He completed his pre-medical microbiology degree at the Colorado State University and then entered the University of Chicago's Pritzker School of Medicine. There he earned his medical degree and completed his orthopedic surgery residency. He then went on to complete a fellowship at the Southern California Center for Sports Medicine. All good so far? That's
yes.
All right, yeah? Dr. Primus also, and his medical staff are also team physicians for the Chicago State University and Whitney Young High School in Chicago, Homewood Flossmoor High School, Crete Money, Andrew, and many others. Our purpose here today is to educate KICS families, you guys, and our entire community what orthopedics is and how and where to go to treat these serious injuries should ever one unfortunately occur with our KICS players. Are you ready?
I'm ready.
Okay, so I've got a list. So, Dr. Primus, tell me, what is orthopedics?
Orthopedics, wow. You know, it's an awesome field in medicine. It's really the study of the entire musculoskeletal system. Mm-hmm. And you're talking all the way from the top of the neck, okay, the cervical spine, all the way down to the last bone in your toe, and every muscle and tendon that attaches to those bones. This also includes the nervous system. It even includes some of the vascular system. So it's the entire musculoskeletal system.
Excellent. What is the purpose of an orthopedic surgeon? Yourself.
Well, yes, you say surgeon because at the end of the day, there's a lot of musculoskeletal care that's not surgery related, okay? And I would say for the average surgeon, most patients that they see in their clinic, they treat in a non-surgical way. And so a lot of it is just managing injuries, a lot of muscle strains or bruises or pulls that you hear of, that we can just still manage. Arthritis, maybe that creeps in, back pain. These are all very basic musculoskeletal issues that we all deal with.
And doesn't require surgery.
And sometimes, a lot of times they don't require surgery.
Excellent. Worried about this. What are the common soccer injuries that require a visit to yourself? What are the common soccer injuries?
Well, yeah, as you know, we are very aware and keen of what's going on with head injuries and particular sports-related concussions. So we'll start there. I'll say one of the more common injuries we see in soccer, and even more so in girls soccer, is concussion. In terms of some of the other musculoskeletal injuries, the knee is the second most common injury that we see in soccer. It's very common. We see a lot of ankle injuries. We see wrist injuries from people falling, but probably the most common thing we see are muscle strains. People it's a lot of running, stopping, pivoting, and people just complaining of muscle strains.
Very common. And what is the difference between a sprain and a strain?
Oh, a sprain and a strain. We get this all the time.
Yeah.
And I have to say we even get confused because the words are so close. But when you think of a sprain, so that's with the P, SP, sprain, you're thinking more of a ligament. So you're thinking more of your ACL. So it's 2 bones that are connected by a cord-like structure, and that cord is the ligament. So when that ligament gets injured in any way, either it gets stretched out too much, and so there's a change in the anatomy, it gets inflamed or swollen, or you have a complete tear, okay? That's considered a sprain, and there can be various levels. So obviously a grade, what we would consider a grade 3 sprain could be considered the worst sprain, and that can be considered a full tear. A strain, on the other hand, so that's with the T, ST, is more of an injury to the muscle. So it's the muscle's connection to the bone. And so there's a tendon that connects the muscle to bone. And so at that level of the tendon, if that gets injured, so whether again it's just inflammation, or it's a partial tear, stretching, or a complete rupture of that tendon, muscle, tendon, bone, that's what we consider a strain.
What is considered longer rehabilitation out of the two, if in general?
Well, that's a tricky question because all of our muscles and bones are connected by tendons and ligaments, and it really depends on which joint you're talking about. Mm-hmm. If you truly injure a ligament, normally it requires a reconstruction. When you're talking about an ACL rupture, and so those are going to be a lot longer healing time. There's other ligaments in the body, such as the medial collateral ligament on the inside of the knee joint, where it has a robust blood supply, and those can heal pretty quickly. And so it's hard to compare. It really depends on the joint and the mechanism of injury. Muscles tend to heal pretty reliably. So those are what we consider strains. So strains rarely require surgery. And so, if you had that.
What is shin splints?
So a shin splint is inflammation of the tendon. Okay, it's the tendons that are attached to the leg muscles. Okay. Those tendons that attach the muscle to the shin bone or the tibia bone, they get inflamed. Mm-hmm. And normally it's a overuse type of injury. Usually there's some imbalance in terms of ankle muscles and leg muscles. And so the tendons see too much stress. They get overworked. And that's the body's way of saying, hey, we need to cut back a little bit. But it's inflammation of the tendon right at the level of the shin.
And how is that? If I was a child, if I was one of the players, how do I? What would I be saying to my mum and my dad where it could potentially be a shin splint? Would I be saying, I'm getting a burning feeling? Is it feeling sore? What kind of? How would you diagnose it, or how would they know what it could potentially be?
Yeah, so it's typically right on the bone of the shin. So if you and the shin bone is one of the most superficial bones in the body, which means there's not much muscle or fat overlying it. So you can pretty much feel the entire shin bone. And so when the child points to their shin and they're saying, this is where it hurts, and I have pain right along here, it's really our first diagnosis. We pretty much give it that diagnosis, and it has to be ruled out by something else. Usually it's something that comes on steadily, with activity. And so it's something where they didn't just turn and twist and have pain. It's something where they were running and they started feeling it, and the more they ran, the worse it got, and then they stopped and it went away. So those are kind of the story, the stories that we like to hear to give more of that diagnosis of the shin splint.
Excellent. And what is a stress fracture?
Well, a stress fracture in many ways can be the end result or the bad consequence of shin splints. Okay, so shin splints are representing increased stress at that area where the tendon is inserting onto the bone. If that increased stress continues, then that stress gets relayed or transferred to the bone, and you can start to have breakdown of the bone. Okay, and so we first call it more of a stress reaction. So if somebody has clear pain right on the bone, but there's no radiographic or X-ray findings that can show a fracture, or MRI that shows a fracture, we call that a stress reaction. And that's the bone actually swelling. It's getting inflamed at that area. If that gets worse, then it can actually break down and you can develop a real fracture at that level.
Which is more serious.
It's very serious, very serious. Stress fractures are probably the most frustrating injuries to treat with athletes, in particular runners. We see this more in runners and people that are doing a lot of heavy, repetitive type of activities.
I'm guessing probably because it's harder to notice it in the first place, right? Compared to a fracture that you may see on an X-ray.
Absolutely, and I would say the biggest reason is the only way to truly treat it is to stop doing that activity. And it's hard to tell a runner to stop running. It's hard to tell these kids that love playing soccer year round, you know what, you're going to have to take some time off. So that's why it's very difficult.
What is a torn ACL or MCL, and what are the surgical options for these being treated?
So the ACL, okay, it stands for anterior cruciate ligament, and it's the most common injured ligament in the knee. So when we see a young child with a pretty significant knee injury, the first thing we're thinking is an ACL injury, anterior cruciate ligament. And let me just demonstrate it on the knee model, because everybody wants to know where is this ACL? What's the deal with this ACL? So the ACL is right in the middle of the knee joint. Okay, you can't feel it, you can't touch it. It's deep in the middle of the knee joint. And so here you can see this band that's going from the inside of the knee to the outside of the knee, and it takes about this angle. Okay. And it's this band that you can see right here. This is your anterior cruciate ligament.
Can you see this? Can you see it on camera?
I'm as close as I can get.
Yeah, just get it pushed up. Okay.
And the main function of this ligament is to actually stabilize the knee joint. And it's stabilizing the knee joint by keeping the lower bone, which is the tibia, underneath the upper bone, which is the femur. And so it keeps these bones aligned and also controls some rotational stability as well.
For a rupture, would you say that the easiest way to potentially rupture stage 3, you said, is a potential rotation of the knee?
It requires a lot of force to rupture an ACL.
Yes.
And this ligament sees a lot of force in a lot of the activities that we do. But there's many ways. There's a impact. If you land the wrong way and hyperextend, you can rupture the ACL. If you impact a certain way and rotate, so it's that rotational torque, you can rupture the ACL.
But less likely, you say it's from day-to-day use and wear and tear. It's more from, as you said, it's a very robust ligament. It's going to sustain a lot of those. It's going to be more impact related or a sharp rotation.
Absolutely, and that's why this is the most common related sports knee injury we see, because it requires that type of high level of velocity to rupture the ACL.
Absolutely. I asked earlier I had an ACL injury. I had stage 3, and I had the patellar tendon reconstruction.
Yes.
Could you just tell me the 3 different options? 3, right? 3 options potentially.
Well, nowadays there's a lot of options.
Yeah. When I had it, it was 3.
But so the ligament is very difficult to heal on its own, because it's deep in the middle of the knee joint. And so the most common way of treating it, and the most predictable way, is surgery.
Yes.
And although there are some techniques where we try to save as much of the ligament as we can, again, the most predictable is reconstructing the entire ligament, which means we have to either take a ligament from your own knee or body, or use a donor ligament or from a cadaver. And that's transplanting tissue, just like we transplant all types of tissues. So there's 3 main ligaments that we can actually take from the body, from your own body, and that is a small portion of your patellar ligament, which is here. Okay. It turns out that you can take up to 1/3 of this ligament, and it doesn't affect in a great deal the residual strength of that ligament. So we can take this ligament. The other tendon that we can take is one of your hamstring tendons. Thankfully, we have 5 hamstrings, so we can take 1, or at times we can even take 2 ligaments to reconstruct the ACL. And then more recently, we've been adopting a technique where we can actually take a part of the quadriceps tendon. And this is one of the larger tendons in the body, and so we feel like this is something that may gain a little bit more popularity.
Absolutely. What is your go-to surgery for this reconstruction?
In terms of the technique?
For the technique, yes.
You know, it varies. I like all soft tissue, which means I like taking one of the hamstring tendons. I can do it in a very predictable way. I can do it in the most minimally invasive way. When you take a hamstring tendon and you quadruple it, so you basically fold it into 4 strands. It's the strongest tendinous construct that we can come up with. But there's benefits and pros to every technique. And so you just, as a surgeon, have to feel comfortable with the technique that you become very proficient with. And at the end, there's been no true proven benefit in terms of one versus the other, because there's so many factors that go into a good outcome after ACL reconstruction.
Go through an injury or soccer-related injury. My question to you, Dr. Primus, where can we find you?
You know, you can find me online. That'll probably be the easiest way at Chicago Sports Orthopedics.
So again, you can find Dr. Primus at one of his locations. Probably the closest one to us is in Hyde Park. You can schedule an appointment at chicagosportsortho.com. What I can say?
And the easiest way is to call. We have a very friendly staff at 708-263-2000.
That's 708-263-2000. Well, that concludes it. Dr. Primus, thank you so much for sitting down with us today.
In your eyes, you want the cup of life. Now that the day's here, gotta go and get it.
So that brings us on to the last and most important part of the interview, our soccer trivia. We're going to give you a soccer trivia right now. If you get 2 out of the 3 questions correct, you will win an official KICS jacket, which we will send you. Are you ready?
I'm ready.
Okay. Name me one professional soccer club in the world.
Oh, in the world?
In the world.
Chicago Fire.
The Chicago Fire. There we go. Closest to home. Question number 2. How many times has Brazil won the World Cup?
Is it 3?
That's incorrect. It's 5.
5.
Leaves us on to the last question. You've got to get this one right. Otherwise, you're going to get the KICS jacket. Are you ready?
I'm ready.
Last question. What is the best youth soccer club in Chicago? And I'll give you a hint.
It's KICS. Chicago KICS.
Well, congratulations, you got it right. There we go. Here's one jacket.